Welcome to our podcast, Disability Warriors, The Download, powered by Liner Legal, your disability warriors, fighting for dignity, justice, and the benefits that you deserve. Each episode, we bring you powerful stories, real legal insight, and everything you need to feel informed, supported, and never alone. Whether you are navigating the complex disability process yourself, supporting a loved one, or just want to understand the system a little better, you're in the right place. Make sure to hit follow now so you never miss an episode. And if you're ready to take the next step, head to our website at linerlegal.com to schedule your free case review.
Because your voice matters.
Your fight matters.
And we're with you every step of the way. Let's dive in. Well, I want to welcome everybody to an exciting new episode of the Disability Download. I have a guest that I'm really excited to dive in. It's our first time meeting, but you have a background and a passion in your career that matches mine, I believe, and I'm so excited to explore this. I want to welcome everybody, Orion Bell, who is the CEO of Benjamin Rose, which is a really well-known and I'm going to give you an opportunity to describe exactly what you do at Benjamin Rose, but it's a social service agency in the Cleveland area. Why don't you describe a little bit about what your mission is? Because it just fits so well with what we do at Liner Legal.
Right. Well, thanks, Mark. I appreciate the opportunity to be here today and the chance to talk to you a little bit. Benjamin Rose, our mission is to accompany people on the aging journey. So our focus has always been, since 1908, when we were established, focusing on the independence and dignity and quality of life of older adults. And we are primarily a social service organization in Northeast Ohio, do a lot of work with aging services programs. That includes things like operating senior centers and being the Meals on Wheels program for much of the county. We do affordable senior housing, a lot of counseling and behavioral health services. And one of our areas of support is around family caregiving. And there's a lot of overlap between issues around aging services and disability services, especially when you look at it from the perspective of a family caregiver. So in addition to being a provider agency locally, we're also an applied research organization. We've been around long enough that we helped develop the idea of aging services and senior services when we started in 1908. And so we do a lot of work in applied research around the issues of family caregiving, dementia supports, supports for people with cognitive impairments, as a part of our applied research at Benjamin Rose too. So a lot of ways that we're involved in providing supports for older adults and their family caregivers.
The first thing that stands out to me when you tell a little bit of the history of Benjamin Rose, it's amazing that the organization has been around since 1908, because when I think about how now, and correct me if I'm wrong, but like the focus of the organization, it's on assisting people who are 55 and above. Is that kind of where your services tend to start?
So most of the time, it's a population of 50 and older. In our mission, we say the aging journey. We don't identify a specific age because all of us are aging, but old is relative. Oliver Wendell Holmes had a quote that says that old is 50.
Oh, you're going real old school now, quoting Oliver Wendell Holmes. Bring it, man.
Old is 15 years older than I am now.
Yeah.
So I think it's a relative thing. And there's a lot of differences in life expectancy and health span and those kind of things. So there are some of our program funders that have an age limit. Some things that are 60 and older or 55 and older. You qualify for Medicare at 65 and older. But the age is not the driver of the conversation for us as we think about the needs of the population that we work with. But generally speaking, 50 and older for most of those client services. A family caregiver can be any age because anyone can be in that role with a loved one.
So tell me about that. For those who don't know, what is a family caregiver? What is the role that they serve?
So when we talk about a family caregiver at Benjamin Rose, and we know that family means a lot of different things to different people, what we mean is the uncompensated family member or friend who provides support for a person that enables them to live in the community. So that might be the parents of an adult child with a disability. It might be the spouse of a person living with dementia. Um, One of my favorite examples of that was we had a client in our aging services program in her 90s. Her next door neighbor's daughter was her family caregiver. She was her power of attorney. She was her supporter because these two lifelong friends had known each other for years. And she said, I want you to look after my mother. And she did. And this was a 40-year relationship between these people that were neighbors. So, family is all of that. But we mean the uncompensated person who's doing that as distinct from the nurse or the care attendant or the PCA that might be involved with the person in providing their care. That's important too. But when we talk about a caregiver, we mean the uncompensated ones.
It's interesting because I get a lot of questions from clients of mine who, we were just talking about this. I think it's called the sandwich generation. Okay. We were just talking about this in the office the other day. And there's a lot of people right now in our country who are caring for their own kids, but they're also starting to care for parents.
Right.
And oftentimes I don't know if it's stress or health issues. A lot of times when you're dealing with your parents and you're dealing with your own children, you're neglecting yourself. So I imagine that's something that you guys are working on with that population.
There's a lot of the responsibilities that fall on a family caregiver can have significant health impacts on those people. You know about the sandwich generation of having, maybe you still have young kids at home and you're also helping your mother or your grandmother. But in the midst of that, you also may be working full time or you have other responsibilities you have in that space too. And that's a lot of responsibility. And so we see some of the impact on that is that, caregivers are more likely to have other kinds of stress-related health issues like hypertension or other factors that may be attributed to the fact that they have those responsibilities as a caregiver on top of everything else they're dealing with. And you may have, sometimes you see the story where, there'll be an older couple and one of them passes away and the other one goes shortly thereafter. Or you have a situation where the same setting, the person who's been the caregiver, the healthy one, goes first. And sometimes that's a function of just the additional responsibility, the additional stress, the impact it has on the person. That's one of the things that we have worked on in developing our caregiver support programs at Benjamin Rose that have helped not only with the person's ability to be a caregiver, but also address the caregiver's own needs so that they're also able to cope and function effectively as a person and not just as a provider of care.
So what are some of the services that are available to those family caregivers?
So there's a couple of really great examples can mention things that are through Benjamin Rose. We have a program that we developed. It's one of our evidence-based projects was called BRI Care Consultation. It was developed by the Benjamin Rose, specifically addressing the needs of a family caregiver. And it is an evidence-based program, guided information, conversations around problem solving or care transitions or care navigation supports, those kind of things. For folks, a conversation directed with a family caregiver about providing care for their loved one and how to build a network of support around that. Organizations all over the country license that service from us as care consultation and deliver it in their local communities. In the greater Cleveland area, we call the program, when we deliver it, we call it We Care Because You Do. And it is our professional staff, folks that are licensed social workers or RNs or occupational therapists that work with family and friend caregivers with all of those conversations around the problem solving, the care navigation, addressing their feelings in the conversation, helping people effectively manage those conversations with the loved one. Because it's a partnership between folks that's a part of that. All those are part of that service. It has the advantage that it can be offered remotely, so people can access the service over the phone or online. They're matched up with a caseworker who works with them all the time. It's the person they're assigned to. And so it's a way to help extend those services. And we're fortunate to be able to extend it here in Northeast Ohio through Benjamin Rose. It's also offered through other community partners across the state of Ohio and in communities around the country. Related to that program, there's another one that's really important, especially if you have people in the podcast that are listening outside of the greater Cleveland area, is that many of these services are also available across the country. Say, our program is licensed in other places, but there are a variety of evidence-based family caregiver support programs that exist. And so we partner with the National Family Caregiver Alliance on a project called Best Programs for Caregiving. That is a way to find out about what programs are available in a local community. If you know your zip code or the city you live in, you can find out about local programs that are available in your own community that serve the population. So that's another way that we help connect consumers with supports and services that may be available in their own community, whether they live in Northeast Ohio or not, and whether they choose to use the Benjamin Rose program or not, because there's a variety of these that have been developed. They've been proven to be effective. They're offered and supported by healthcare systems or other nonprofit organizations, but have demonstrated that they are effective and supportive in that space. It's Best Programs for Caregiving, and it's a free resource that's available all over the country. And I'll share the website with you as well.
And we'll make sure that we get that in the podcast notes up there for everybody to see. You mentioned, and I talked about it a little bit. We were talking about this sandwich generation, how a lot of times these individuals who are trying to care for their children as well as parents or somebody else, they start to take on their own health issues. Oftentimes they'll, because maybe they can't work because they're struggling with that, they'll reach out to a disability lawyer like me, with some of their own health problems. But then, and here's really where I want to go with this. So one of the key words in your definition was uncompensated. But a lot of times what will happen is somebody who is a daughter or a sister or something like that will find access to funding through the county or the state. And how does that fit into your ability to give them services? Because then they kind of go from being uncompensated to, they might, what they'll say to me, and it causes an issue for their disability cases. Well, I care for my mom. I sit with her, but I'm being paid $16 an hour for 40 hours per week, even though I'm really just sitting with my mom. So I'm not really working. And you're smiling, so you've got some thoughts on this, I imagine.
Well, and I think that's an evolving area in terms of home and community-based services, and you do see in Ohio that addition of that structured family caregiving kind of arrangement is pretty new. It's actually been in place for people with a loved one with a disability or developmental disability longer than it's been in place for the aging population. But that is as a support service, it's one of the innovations of a way to help provide appropriate and adequate care for a loved one in that space. As far as the relationship between that person and the family, that would not keep them from participating in our caregiver support programs, because I think one of the things that's very important in any of those conversations is the importance of having a network, that the caregiver needs support. The person who is the care recipient, their care partner, they need the support. So you're trying to build a network and a conversation space for that. And so that sort of arrangement with structured family caregiving or those kind of programs, the person's still in a caregiving role. And they probably didn't come to that from the role of being a medical professional. Maybe they did, but a lot of times they've stepped into that role because they learned how they care for this person. It's a bond that existed before the diagnosis or the condition came into play. So that wouldn't keep them from being part of the conversation.
Now, we've kind of delved really deeply into this, the family caregiver, but that's not even like the largest service that Benjamin Rose offers. That's just one of many. What are like the bigger services when people think Benjamin Rose? What is a typical call that you receive from somebody who's interested in your services?
Well, we usually talk about our services as 4 service pillars.
Okay.
And the first of those is the home and community-based services. The family caregiving is a part of that. But it's also things like we operate our Rose centers, which are senior centers that operate across Cuyahoga County.
How many of those are there?
We have 7 sites. And then so that is social and recreational activities for older adults. Those are also nutrition sites. We offer a daily meal as a part of those programs 5 days a week. It's a hot lunch program for participants that are at the sites. Our biggest program in terms of those community services in terms of budget is the nutrition programs, the Meals on Wheels programs, and that congregate site service at a center. We serve about 750 to 800 meals a day through a Meals on Wheels route or at one of the senior sites. Most of our home meal delivery participants are homebound. So it's an older adult, and the driver who visits them to deliver a meal may be the one other person they see that day in the community. Part of that program is what we call a medically tailored meal, where a diet is developed because of a person's diabetes or renal disease or heart disease, and they're on a special diet because of that. But all the meals are nutritionally balanced and provided in that way. Another service that's part of that programming is our other behavioral health counseling and support services that are offered. We specialized in terms of the counseling services for people that are 50 and older, 55 and older, and including people with serious mental illness, folks that might take part in a group therapy program and those kind of things. All that's all part of that home and community-based services bucket. The second broad pillar is our housing and home ownership programs. So we operate an affordable senior housing building, our Margaret Wagner Senior Apartments in Cleveland Heights. In addition to that, we also work with developing home ownership programs. We're a HUD-certified housing counseling agency for helping people be prepared for purchasing a home, the budgeting, understanding the rules and the processes of all that. We feel really strongly at Benjamin Rose that a strategy around stable housing is critical to any conversation about successful aging. So we'll work with somebody maybe in their 20s or 30s trying to buy their first house, because a retiree with a mortgage that's paid off has a lot more options about what they can do in retirement, because that home is a valuable resource for them as their housing, but also as the individual wealth and the investment value it has. If they choose to do something else, that's often how people can finance those if they take that step next. Third pillar is around financial wellness. We do a lot of financial counseling and financial information, financial literacy, computer literacy programs, those kind of things. Mostly focused on an older adult population, but not exclusively. We learned during the foreclosure crisis back in the 2008 that the median age of a person in foreclosure in the greater Cleveland area was 62. Wow. So it is an aging person's issue. But so that's another area where, again, with financial stability, helping people with financial planning, helping with benefits enrollment, understanding about the public benefits that are available, selecting an appropriate insurance plan, those kind of things where we can be helpful with that. And the fourth pillar is the research programs. We've talked a little bit about some of the research efforts. We have, in addition to the caregiver support programs that I mentioned, we have another dementia-focused program called SHARE, which is really focused on early stage dementia patients and their loved ones, where they're able to be involved in conversations about their care planning, their care needs, the things they want to do going forward is another example of that. But we work with adult protective service programs across the country. We do a lot of work in the elder justice space. Uh, just looking at ways that you can preserve the dignity, the independence of people throughout their life, uh, regardless of the challenges they're presented with.
It's fascinating to me because something that I hear from so many of my clients is they never wanted to have to apply for disability. They never expected that they were going to apply for disability. And they lived their life in a way where they weren't really planning for it. And so when I hear you talk about all the services that are offered at Benjamin Rose, it makes me want to think and say, all right, so I'm 40 years old. I'm healthy. I'm financially healthy at this point, knock on wood, right? But you don't know what's going to happen tomorrow, right? I get into a terrible car accident or something happens. Is it worth it as a part of my, and are there services as a part of my future planning to consider engaging with some of the services that Benjamin Rose offers to be ready for what might happen? Is that kind of what you're saying, where people don't know what's going to happen and we kind of help you take the steps to be ready for that?
We're big believers in planning at our agency, and obviously, I always tell people, we're not a law practice, we're not financial planners, we're not your physician, but there are conversations that you should have with your loved ones. You should have, regardless of your age or your health, you should have the conversation about, uh, end of life care and legal planning, and everyone should have a will. Everyone should be thinking about those things like advanced directives and sort of the planning about, in the event that something happens and my voice can't be heard in the moment, I want people to know what I want, and I want to have things in place that allow those things to happen. So yeah, we would refer folks to professionals in those spaces as well. And I would say too, a lot of times as we talk to people in those professions, sometimes we'll say, you know what, we can be a good connection for those professional services as well as someone to refer to for those other questions that are outside your professional scope. I know just from lots of experience in conversations with clients and folks that we work with, there are times when an older adult will confide something in their banker or their CPA or the family attorney that they haven't told their kids, they haven't told their spouse, they haven't told their doctor, but because it's a trusted person. And so I think there are a lot of opportunities to look for places where you can have the conversation about caregiving and an informal network of support and the things that help people navigate those conversations.
Is it ever too early to start conversations like that?
I don't think it is. I think just in my own personal experience, when my first child was born, that's when we put a will together.
You're ahead of me.
And I told you before we began the podcast, I have a brother with cerebral palsy and significant levels of physical and developmental disability, and so because of that, grew up in a setting around conversations about, as he turned 18 and, wasn't under parental authority anymore, and he had the conversations about guardianship and powers of attorney and those kind of things with him. So I learned some of that earlier than some people just from my own life experience. But I think it's always important to be thinking about, planning for what's next. Not from a doomsday scenario, but just it's a way to have some conversation and some control and some awareness about what's important to you, what you value, where you'd like to be, and that requires a conversation in being able to do that. So I think that's always good advice.
Yeah. I just think that that's such a great tip that we can share, because there's, many people who may be tuning in and listening to us who are in a circumstance where it's too late and or maybe they are, a family caregiver or something. But there's a lot of people that are just listening because they happen upon this, and if we can give a tip for everybody, it really is the warning. It's very rare that I get a call from a new client who says, I've been waiting to call you. Or, I'm sure it's the same with your services. Here's the 9 steps we've taken to be ready for the services that you offer. They come to you and they come to me and they're scared and they're confused and they don't, these programs that you help people access or offer yourself, the benefit programs that I work with every day, it's a maze. It's a maze.
And say people come to you in a point in crisis usually, because that's what brings it out. And I think the other conversation we have sometimes is that I'll be giving a talk somewhere or talking about the services, be at a cocktail party. Says, what do you do? And inevitably there'll be somebody that'll respond to that with, I wish I had known about your program when, and that's when you hear about their mother or their aunt or their loved one. And I think people don't look for things early. The organizations often don't. We don't have the big budgets to go out and promote the programs maybe in the way you might some other products or services. So just helping people understand that the supports are available, that they exist, that there are opportunities for things that are consumer-sided, consumer-based, that not everybody is selling you something. There are some resources that help you navigate to those programs from the perspective of what's best for you and what you want to do and what your choices are, things that are person-centered, person-focused. And they're out there. Sometimes they're a little hard to find. And so opportunities like today to talk about it are important for that and helpful in helping us do our job by helping people find us.
Yeah. The education piece is huge, just because you're right. There's, I think there's a lot of natural tendency for people to think that if somebody's offering to help them, there must be something that they're looking for in exchange. But I imagine that, most of the funding, which allows you to provide this program, it's grant funded. It comes from government assistance.
So we have a variety of funding sources at Benjamin Rose. We were established by Benjamin Rose, who left his fortune to start the Institute. But we also have funding from philanthropy, from foundations and grants. There are some public dollars that go into those programs. Organizations like the Western Reserve Area Agency on Aging or the Adams Board or, those are sources of some of the public dollars that come into those kind of programs. So there's a variety of funding sources, and a lot of them are not income based. Some of them are. Some of the things like some of the Medicaid services and some of that require a person to have a certain low income to qualify for some of the programs. But a lot of the informational supports and the counseling supports, a lot of things we've talked about today, especially around the caregiving services, those are not income-based programs. It's for anybody that needs them. And part of the information and part of the guidance for it is built around what the person is able to do, what they're capable of doing in their own setting. We're all different, right? We all have our own story. We have similar challenges, and it is a maze to navigate, as you said. But there are options for people to help them navigate through that, learn from the experience of others, share information, and all of that is helpful in helping people navigate those conversations around aging and disability and caregiving. One thing I thought we might talk about a little bit was just sort of in the regulatory environment and the rules we operate, the space you operate in, the space other clients operate in, is that you have one set of rules that applies to disability services and programs across the range. And sometimes there's some tension between the needs of a person in their 80s with a cognitive impairment and a Alzheimer's diagnosis, has a different set of needs and a different life course than the rising young adult with with Down syndrome in their early 20s. And one of the places you see that is in conversations around congregate setting for programs. You see it in trying to navigate the discussions around supported decision making versus guardianship and the roles and power of attorney. It's and we have a lot of really dedicated people that work in the space, and but sometimes the needs of the populations collide because the condition they share is not. Um, it's different if you're in your late 20s or if you're in your 80s. And for example, we'll work with the population sometimes with people that have had a traumatic brain injury because of an accident or an illness or an injury in their 30s. And they don't fit the definition of developmental disability, but they're also not 80 years old with a dementia diagnosis. And that's one of the places where sometimes it can be a real challenge for people to find services and to connect to supports because they don't fit neatly into, this camp or this camp.
Right. You're towing several different lines there. And that's one of the things that Benjamin Rose steps in and can assist with.
Well, I think that's one of the reasons why when we talk about the conversation about a caregiver, so there's not an age, right? It's not a specific medical condition. It's not a specific illness. It's not a specific age. The thing the caregiver needs help with is not dependent upon why their loved one needs care. It's the fact that their loved one needs care or needs assistance or needs help with paying the bills or, navigating those activities of daily living. So it's important to not pigeonhole people in that way. I think that sometimes that's one of the challenges folks who don't reach out for support is they look at the sign and go, well, that's not for me. I'm not
55.
I'm not old enough, or I'm not sick enough, or I'm not poor enough, or and say, well, start the conversation, ask the question. There's no harm in it, right? You can learn about what's available. It may be more than you think. And the humbling side of that is that most of those services grew out of those conversations of people trying to figure it out. The space for aging services programs, a lot of the really creative things that have been developed in the disability space and in the mental health services space and behavioral health services space have been developed by consumers figuring it out as much as they've been developed by, the professionals in the field. It's, so I think it's important to encourage people to ask and to have the conversation and knowing that there are gaps. There are some things we don't have figured out yet. I think one of the most powerful places for that, where we can find a lot of common ground, is through the conversation as a family caregiver. Because, the person who has the adult child with autism or on the spectrum, the person with the developmental disability, the person who's dealing with Parkinson's disease or Lewy body dementia, they're on a different path to get there, but they're navigating the same challenges. And so we're finding ways to help, improve the service, improve the quality of support, expand the ability of people to live in the community. All of that happens if you can get more people talking about what they have in common instead of pigeonholing us into things that keep us separate.
A question that I have that's just coming into my mind right now is how you, and if it's even important to kind of cross cultural barriers or cultural lines that are out there, where Cleveland and Northeast Ohio is truly a melting pot, right? I mean, we have one of the fastest growing Hispanic populations in the United States. Cuyahoga County has a huge African-American population, but historically, is a very, Caucasian city, but I mean, from all over the world. So what's it like having a social service agency where you are dealing, with people from so many different backgrounds and cultures? They still probably have true commonality in these issues, but the way that different communities address these, aging and illness is different.
It does vary, and you get different expectations from families sometimes about who provides care and what the setting is and has that. And um, and all of those factors play into the conversation. I think the other thing that happens in a place like Cleveland too is you also there's a lot of mobility in that the family, grandma may be here, but the family's someplace else.
Right.
And that also becomes a factor in those conversations in terms of when folks are spread in great distance from each other. I mean, we see that with our population. I think for us, one of the things that we strive to do is to make sure that we try to be present in as many of those communities as we can be, and encourage people to participate and be involved. And sometimes if there's a language barrier, sometimes if there's a culture barrier, you have to work through that. And sometimes you just have to be aware that it's there. And I don't know that as well as maybe I should. And so a lot of that learning comes from the folks you're working with. But there have been really effective programs around caregiving that have been developed specifically for folks maybe in a Native American population, where not only the cultural setting might be a little different than yours or mine, but the acronyms of all the federal agencies are different too if it's a Native American program. Or you have programs that have been developed for folks maybe where English is not the primary language spoken at home, or people first generation. Stories that some of our family caregiver counseling staff will talk about for the person that as their cognitive impairment progresses, they may lose their English, but they still remember the Romanian or the Czech or whatever it was that they learned as a kid, and because that memory is deeper. So just having an appreciation and a sensitivity to it, and understanding that that's part of the environment that you live in. And it doesn't mean you have an answer for all of those, but you have to be open to the notion. That's part of the conversation for people, and finding solutions and helping navigate that. And we don't always have the answer, but we can help guide the conversation sometimes with the family. It says, well, how can we do that? How can we address that for that person?
And what's the best way for somebody to get in touch with Benjamin Rose? If I'm hearing this and I'm thinking, boy, it would be really helpful if I have questions about being a caregiver.
I always tell people that one of the best ways to find information about us is through our website, which is at www.benrose.org. A lot of information there about all the programs.
Is that what his friends called him? Benny?
He was Benjamin.
He was Benjamin.
To everybody.
Okay.
I think even Mrs. Rose called him.
Back in 1908, I imagine Benjamin was more fitting.
But it's at benrose.org, and a lot of information about programs and services. It's a place if you want to sign up for classes that we do, or learn what's on the menu at the senior centers that day. All that kind of information is on the website. There's also a section about our applied research. So maybe for example, if you're someone who's a loved one who has dementia and you want to learn a little bit more about the disease, or about the services or research in that space, or where you can be involved, we have a whole section on our website of publishing of our evidence-based work, the projects we've done, the research scientists that have been a part of it, because the point of it is it's applied research. It's to promote best practices and put the information in the hands of the people that can use it. The other way to do this, and especially for the folks that don't want to go traipsing through the internet, is you can call our direct number, which is 216-791-8000, and the receptionist can direct you to the intake staff who can answer those questions, point you to any of those programs over the phone, as opposed to having those things online. So we try to make those things available in that way. And just a variety of ways for people to connect. But the phone and the internet are the easiest ones for most people.
Got it. Well, and as always, one of the things that we love to do on the Disability Download is to let people know about these resources, make sure that they're aware that whether you're in Northeast Ohio or you're in Southern California, there are services that are available. There's networks that you can tap into to get the help that you need. And you just got to raise your hand. So this is a perfect example. I'm so glad that you came and spent some time with me today. And I really hope that this reaches the people who need it, because the help that you're offering changes lives for those who are going through the health circumstance themselves, but also those who surround themselves with. And that's what we love doing, not only here on the podcast, but also, in my professional practice, Liner Legal. So,
Well, thanks so much. I appreciate the opportunity to visit with you today, and especially the value of the work you do in the community and helping connect people with resources.
thank you. Thanks for tuning in to Disability Warriors, The Download. If today's episode inspired you, educated you, or gave you hope, don't forget to subscribe, leave a review, and share it with someone who needs it. Need help with your disability claim? Visit linerlegal.com today to schedule your free consultation. Stay connected with us on social media for more stories, insights, and victories from the disability community. Until next time, stay strong, stay empowered, and remember, you are not in this alone.
Because your voice matters.
Your fight matters.
And we're with you every step of the way.